Hello again, this is Dr. John Willer demonstrating my technique for use of the Expand Iris Speculum pupil expansion device. This is one of my Flomax patients, as I'm sure you all recognize by the small pupil. And if you watch when I put some viscoelastic in, the pupil will kind of move around a little bit, just like floppy irises do. So this is a perfect case for the Expand Iris Speculum. I'm using a 2.75 millimeter keratome. Once the incision is made, I'm ready to go with the ring. If you notice there, the pupil contracted slightly when I withdrew the keratome, and that is a very good indicator, in my opinion, that the iris will be floppy during the case. I always rebolus a little bit with some additional viscoelastic. Now the eye gets out of focus because I'm up focusing so I can see the ring within the package. And I carefully unscrew the top. It's not threaded, I just kind of use a twisting motion to open the top and carefully grab the speculum. It's a very springy device and is easily lost. Sometimes the speculum will swing down like that, as you see on the forceps. That doesn't make any difference. It's just a matter of how you grab it and if it's in the grooves. It'll always go in just about this far, and then all you've got to do is nudge these extra hooks in. Once they're in, you can drop the distal hook, close the forceps back up again immediately, withdraw your forceps, grab the exterior portion of the ring, and place it into the anterior chamber. Once it's in the anterior chamber, I switch over to my Lester hook. For the sides, I point the hook superiorly, and I can even drag the ring into a better position, pre-placing it to engage the contralateral hook, as you can see here, making sure to keep my Lester hook above the iris and not behind it. This way, the ring is already placed in an excellent location. I don't have to do any further manipulation. I'll just rebolus with a little bit more viscoelastic. This happens to be Provisc, and I'm ready for my capsulorhexis. This is the very end of this case. I won't bore you with a standard divide and conquer technique. As you can see, everything looks great. We're ready to put some Provisc in the capsular bag in the anterior chamber and get the lens in. This is a ZC-BOO lens from AMO. It's an excellent lens. Goes in real easily. And I rotate it superior to inferior. Now frequently the haptics will stick to each other or the optic of the IOL. So I am very careful to make sure that the haptics are not stuck to the IOL and that they are in fact in the capsular bag and over the edges of the optic. Then I can proceed to explant the ring safely, knowing that the IOL is in the capsular bag securely. I'll push the ring a little bit further away from me and go right underneath the proximal loop, drag it out of the eye with my Lester hook, and down the contour of the globe. It's very important to follow the contour of the globe downwards and outwards. Next, I just use my insertion forceps on the right side only to pull it out of the incision. If you use both sides, or if you go back and forth, a lot of times the ring will hang up on the iris or the capsular bag. This is a really easy, quick way to explant this ring without too much fumbling around. Next, I'll put it right back in the container. The scrub hands me the container with the slot away from me, which you can see the slot is for the insertion forceps. Once it's safely in the holder, I'll put my finger over it, press down and roll my finger over it to ensure that it is within safekeeping in the container. This is the patient's contralateral eye. Slightly more dilation this time, but I don't trust it. Moves a little bit. In my neck of the woods, any old man with a moderate-sized pupil has been on Flomax, whether they remember it or not, and that's an important fact to remember, that not all patients remember all medicines they ever were on. And some patients may have taken Flomax years prior, decided it didn't work, and then discontinued it, not thinking anything of it. So once again, I'm up focusing to give myself some room to focus on the cartridge, the container of the ring. Visualize the ring, tap on the top of the container to make sure it's not stuck to the top, and I'll use a twisting motion to remove the top of the container, watching the ring within the container the entire time. Now I'll focus down. As you notice, this ring this time did not swing down like it did in the other case. It really doesn't matter what it does or doesn't do there. I'll nudge these hooks in. Once they're in, I can drop the distal hook. Which almost always engages the pupil when I do this. You have to aim low when you grab the proximal part of the ring, because it's usually in a blob of viscoelastic, and there's an optical effect where you have to aim low, if you remember that from basic sciences. I apologize for the framing. I'm a total amateur. I'm also a total amateur at editing videos. So pardon me for that, please. I assure you I can see everything through my microscope. The framing is just a bit off with the camera. Again, I rebolus with a little bit of Provisc and get on with the case. This case went off as well. No complications, nothing unexpected. So we'll put the lens implant in. You'll see a very similar, if not identical, explantation procedure. Again, making sure that the lens is fully within the capsular bag. And as part of my rotation, I sometimes nudge the haptics. And once they're over the edge of the optic and into the capsular bag, I'm ready to explant the loop, the speculum. I'll push the speculum away from me to enable me to grab the proximal hook easier. Now I'm pulling it down the contour of the globe, setting the stage for an easy removal. Insertion and removal forceps in the right hand and Lester hook in the left hand. Again, following the contour of the sclera, following the contour of the globe posteriorly. This is how it comes out, and I take it out just from one side only. Now we'll up focus and put it back in its container. Thank you for watching. Hopefully you'll get something out of this. This is a really great device to use. It has changed my operating outcomes and decreased my stress level greatly. I'm glad they invented this.